Okay, this is going to be histology part 2, and if you remember, just as we had 4 types of tissues, which would have been epithelial, connective, muscle, and nervous tissue, we're going to do this one starting with connective tissue. And there's 4 types of connective tissue. So, connective tissue is the most abundant one distributed throughout the body. And the 4 types are going to be connective tissue proper, that I'll explain in a few seconds, cartilage, bone, and blood. So if you look at that, you're going to think, why is blood in with things that are bone and cartilage and stuff that's going to be making up connective tissue proper? The reason for that is it all comes from a common embryonic origin, which is called mesenchyme. So because blood meets that criteria, it is going to be one of the ones that are going to be included into the types of connective tissue. All connective tissue has embedded or suspended in its extracellular matrix cells. So I'm going to go and explain that the way that I think is the best way to learn it. I will also go off of the same thing that I did for epithelial tissues, which is the charts in this particular book, because I think it explains everything clearly. So all connective tissues, even blood, have 3 main elements. One of them are going to be ground substance and fibers. Those are going to be making up the extracellular matrix, and then the cells that are embedded in them. So depending on how the ground substance and the fibers are arranged and the cells that are in it, you can have a whole bunch of different types of connective tissue. And the ground substance, which is kind of like the background matrix. When I finally get to talking about the cartilage, I'm going to explain to you that the ground substance to me reminds me of cells, which are going to be a cereal, rice puff cereal, in skim milk. You'll see that when we finally get to it. So the unstructured gel-like material that fills the spaces between the cells is called the ground substance. Most of the time, the ground substance is going to consist of proteoglycans. Most of the time, it's going to be chondroitin sulfate and hyaluronic acid. And then trapped in between it is going to be water. I'll explain that a little bit later. And so essentially, that's what makes up the ground substance. And then the cells are going to be what's going to be stuck in there. The fibers, there's 3 types of fibers. One of them is collagen fibers, which is really strong. The second type is elastic fibers, which is going to have a little bit of a stretch. And the third type is called reticular fibers, which is kind of like, I think of it as a hairnet holding things together. And we'll go through all of them. The cells themselves are either going to be mature or immature cells. If they're immature, they're going to be called a blast. So in the bone, it's going to be osteoblast. The prefix osteo means bone. Chondroblast means, chondro means cartilage, and fibroblast is going to be the connective tissue proper itself. Anytime it says site, it's just a cell that's going to convert into a blast that will convert into a site. Other stuff that you'll find in the background, which is, remember, all of this material is underneath the epithelial tissue, are going to be fat cells, white blood cells, mast cells, macrophages, and things like that, that are all going to help protect your body once you've gotten past the outside barrier, which is going to be your epithelial connective tissue. So there's 4 types of connective tissue, as I mentioned a second ago. One of them is connective tissue proper, which there's a bunch of them. I'll go over them individually. Cartilage, there's 3 types of cartilage, and I'll get to that. Bone is going to have spongy bone and also compact bone, and blood is just blood. Usually in A&P2, we start A&P2 talking specifically about blood, but you need to be able to recognize that it is a connective tissue, but it is a liquid connective tissue. So the connective tissue proper, like I said before, I'm going to go right off of these charts in this particular textbook. This is what they look like. It truly looks like someone took a magic marker and scribbled all over the board. The other two things, just like you had to know with epithelial tissue, is where would you find it and is its function. So the function of areolar connective tissue is to wrap and cushion its organs, and because it's underneath the epithelial tissue, it's going to have within it stuff like macrophages and white blood cells that will phagocytize bacteria, which means eat bacteria. So if you got bacteria on your skin and you get a break in your skin, that bacteria is now inside of your body, and this is going to be one of the first lines of defense because it's going to have things or cells in it that will eat the bacteria. In addition to that, all of these squiggly lines here are going to convey tissue fluid. One of the examples I'm going to give you is when I finally get to dense regular connective tissue, and if you've ever sprained your ankle, where the heck did all that swelling come from? And I'll explain that when we finally get to it. So where would you find areolar connective tissue? It is underneath the epithelial tissue. So if you want to think of this as stratified squamous epithelium, which we'll get to a little bit later with skin, the lamina propria that's underneath the epithelium is going to be made of areolar connective tissue. It is going to be around capillaries. You have miles of capillaries in your body. It's also going to be around organs and stuff like that. So the reason that it's mostly found in your body is because it surrounds everything. Think about miles of capillaries, and this thin connective tissue is holding it all together. It basically, you got a lot of them. So that is the first one, which is areolar connective tissue. And this is what the picture looks like. It really does look like that, even when you're looking at it from the microscope. The second type of loose connective tissue is called adipose connective tissue. This particular slide here is of a silver nitrate, but a lot of them are pink. And so I think they look exactly, because all of this is filled with apocytes. So this is all adipose tissue in here, and you can kind of see the nucleus is, there's so much fat in here, the nucleus is jammed over to the edge. So as it says, the matrix is as in areolar, is very loose, but very sparse. Closely packed adipocytes are fat cells that have a nucleus that's pushed over to the side. They remind me of the bubbles, the packaging bubbles. So if you want to, what does this thing look like? It looks to me like packaging bubbles. For those of you who have problems, pop, 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 pop. One of the best things you can do in life is pop packaging bubbles. The saddest thing is the packaging bubbles no longer have air in them. They have little channels in them now. And so anyway, what is a function of adipose or fat? It does a couple of things. It provides a reserve food fuel. So if you were a squirrel that we have in my yard, around next month, when it's going to start getting cooler, he's going to start storing up with acorns. So my squirrel doesn't look like a skinny little squirrel anymore. He looks like he's on steroids because he's storing up all the fat for the winter. He can't go to Weis or Wegmans to get food. He has to rely on the fat stores. It's going to insulate against heat loss. So older people particularly start to lose their subcutaneous fat. And one of the things that happens is my mother, who is in her late 80s, is always cold, except when she's hot. So when it's just very comfortable out, she'll still have a sweater on because it's a little chilly. It is because she has lost some of her fat stores underneath her skin. In addition to that, it's going to support and protect organs. Most of you probably know that you're going to have fat around your kidneys. That is perfectly normal in case you have someone punch you in the kidney. So the functions are to provide a reserve food fuel, insulate against heat loss, and support and protect organs. So where are you going to find them? As I mentioned before, it's going to be underneath your skin. That is called your subcutaneous fat. It's going to be around your kidneys, as I just mentioned that. It says, and eyeballs. Your eyeballs are not made of fat. The fat pad behind them is protecting them in case someone punches you in the eye. Breast tissue, for the most part, mostly is made of adipose connective tissue. There are some glands in there that are called mammary glands that are not going to be made of adipose, but under certain circumstances, they will create milk for a newborn. And of course, within the abdomen. For all of us, and I'm including myself, some of us have a spare tire. So the adipose connective tissue is there to allow you to make it through a cold winter. We are not going to usually starve, but at the same time, my squirrel in the yard will probably get nice and fat for the winter because he's storing up on his nutrients, particularly if we have a nasty winter and he can't get acorns. So we have areolar connective tissue, which looks like someone's just scribbled all over the board. We also have the packaging material, which is the adipose connective tissue. Those are the two loose. And the third loose is called reticular connective tissue. Reticular connective tissue is probably easiest to sum up by saying this is what's going to be inside of a lymph node. So they do say, where would you find it? Well, you're going to find it in the spleen, because as blood goes through the spleen, it filters all of the dead red blood cells out. So I'm going to give you a quick AMP2 lecture on lymph nodes. So if you got a rip-roaring streptococcal infection in your throat and you feel alongside of your neck, you'll probably notice that there's some bumps in your neck. So as the lymph goes through your bloodstream and it goes through this lymph node here, the lymph going through it is going to be returned back to the heart. The lymph node's purpose is to filter the lymph going back to the heart so you don't spread an infection. So if you have a rip-roaring streptococcal infection in your throat and you feel alongside your trachea, you're going to probably notice little enlarged ball-bearing-like feeling things. And that is nothing more than the lymph node doing what it's supposed to do while you're dealing with the infection, which is, in this case, streptococcal infection. So you would have these lymph nodes alongside of your neck, underneath your chin. You'll also have them in your armpit. They are all over your body. When you get to AMP2, you'll kind of see, and we do a whole section on the lymphatic system. Inside of these, some of these things, and they don't point any of them out, would be an internal skeleton consisting of white blood cells, mast cells, and macrophages. Their purpose is to filter anything that's going through it so that it, as it gets returned back to your heart, it's going to be pure rather than having little traces of streptococcal infection. So the lymphoid organs are going to be the lymph nodes, as I mentioned, the spleen, which is going to filter out all of your blood as it brings it back throughout circulation. And your bone marrow is also going to be some of the organs that would be responsible for having or being mostly made of reticular connective tissue so that they work as a filtering. For me, I always think of this slide here. If I took a bunch of grapes and held them up against my face, those grapes are the suspended cells here, and it's kind of blurry with my vision, and that's what it's going to have to go through. So in this particular side, you have reticular connective tissue, which you would find in lymph nodes and the spleen. Going backwards here, this is the adipose connective tissue, which looks like bubble wrap, which would be around certain organs in breast tissue and underneath your skin. And lastly here, the areolar connective tissue, which would be found around all capillaries, all organs, making up the lamina propria of the epithelium, or underneath the epithelium. And so those are all of the connective tissue proper that are loose. There is connective tissue proper that is dense. And so this particular one here is dense regular connective tissue. The good thing about this, and I'm going to show you something on my whiteboard in a second, these wavy things here are all going to have a certain stretch to them. I'm going to exaggerate that stretch because as you pull it apart, you are going to stretch it out. So if you come over here to my board here, here is the picture that is over there, which is going from A to B, whatever this might be. It could be an ankle. So this is dense regular connective tissue. And you'll notice that once you stretch it out and go from B to B1, you have stretched it to here. And this is called your elastic limit. all of these tissues have an elastic limit. And if you look at them, there's in three places: a tendon, a ligament, or an aponeurosis, and I'll explain that. So if you stretch your ankle, you turned your ankle and you brought it to here, it might hurt because you've reached its elastic limit. If, let's say, you stepped in a gopher hole and you stretched it beyond B1 to B2, this is called plastic deformity. You don't have to worry about that because you're just going to call it a sprain. So a sprain is something that has been stretched beyond its elastic limit and you have damaged it. And of course, as some of you are going into OT or PT, you're going to have a first degree, second degree, third degree sprain, but basically, coming back over here, this tissue here is a tendon. A tendon attaches a bone to a muscle. This is the bicep brachii muscle. And so a tendon, by definition, attaches a muscle to a bone. A ligament, by definition, attaches a bone to another bone. So they look exactly the same. This wouldn't be any different. The only difference would be what does it attach to. So a tendon and also an aponeurosis is going to take a muscle and attach it to a bone. A ligament attaches two bones together. In this case here, it's the shoulder capsules that's going from one bone to the other. An aponeurosis is a tendon, but it's a broad tendon. We haven't gotten to muscles yet, but the latissimus dorsi is a big back muscle that attaches to the spinous processes of your thoracic spine. So what is it good for? Its function is to either attach muscles to bones or muscles to muscles, and it attaches bones to bones. And it has a great strength in one direction. It's not really good in multiple directions. So if you tear this tendon here from the bicep muscle, you are tearing it in one direction. So when a force is applied in one direction. So this dense regular connective tissue, two examples are a tendon and a ligament. That's what most people are familiar with, but it looks like that, and it would also look like what I drew on my whiteboard. Although I accentuated this, but there is kind of a waviness to these tissues there. Not everything in your body has a pull in one direction, so there is something called dense irregular connective tissue, and in this particular case, it is going to withstand tension in multiple directions. For example, the picture that they show here is a shoulder capsule. And you can look at me for 1 second. I can take my arm and go this way. I can go up. I can go like this. I can some days even do this. So my shoulder has multiple directions that it can go. Probably a better example is the dermis of my skin. So if my videographer comes over to here and I push my skin this way, some days it snaps right back, but because I'm getting older, it does not snap right back. So usually I'll take somebody in the class's skin, I'll pinch that, and it'll snap right back. As you get older, you lose some of that elasticity in your skin, and you also lose some of that ability of your dense irregular connective tissue to snap right back. Okay, so those are the two types of dense. One is dense irregular, which has a pull in multiple directions. The other is dense regular, which is a pull only in one direction. The last type is called elastic, and we really don't go into it, but we'll discuss it in A&P2. Elastic connective tissue is going to be mostly in the large vessels coming out of and going, particularly out of the heart. So as the left ventricle pumps it through here, there is going to be a stretch because all of these elastic fibers allow the blood that gets squirted up this way. It actually has a recoil that'll help work towards your pulse type of thing. So those are the different types of connective tissue proper. Cartilage is the next type. Cartilage is interesting because the matrix is secreted from the chondroblast. Remember, that is cartilage cells, and they'll become chondrocytes once you are an adult. Mostly they're found in little cavities which are called lacuna. So cartilage itself is 80% water, packed with collagen fibers and sugar proteins such as chondroitin sulfate and hyaluronic acid. And the good thing about cartilage is it's tough and yet a flexible material that lacks nerve supplies. Why is that good? It's good because it does its job really well, but if you damage it, it's not going to be too painful unless you really tear it apart. Avascular means it does not have a vascular supply. So think about that. If you don't have a good vascular supply, it isn't going to heal so well. So cartilage, if you've ever blown out your knee one way or another, it does not heal well at all. And a lot of people who have played sports have knees that are kind of shot. You go up and down steps and it hurts going up and it hurts coming down. So the cartilage could be damaged. There's 3 types of cartilage. One is called hyaline, the second is elastic, and the third is fibrocartilage. The hyaline cartilage kind of looks like a shiny bluish glass, or if you're eating steak and it's not a piece of meat, which is the steak, the gristle of a steak is hyaline cartilage for the most part. They have a whole list, and I'm going to go to the charts that I've been using for everything else as to where it is and what it does. So here's what it looks like. To me, if you think of this whole background matrix as skim milk, each one of these cartilage cells, which is a chondrocyte and a lacuna, to me looks like Rice Puff cereal. So if you haven't eaten Rice Puff cereals in forever, that's truly what that cell looks like. So the cell itself is this dot, and the lacuna is, it looks like a little boat. So the little boat is floating in a sea of skim milk in this particular example, and this is what's making up hyaline cartilage. So where are you going to find hyaline cartilage? It's going to make up the embryonic skeleton. So before you get bones, in order to make the delivery a little bit easier, the fetus, or the baby as the baby's coming out, is made of hyaline cartilage. It's going to cover the ends of all of your bones. It doesn't matter what bone it is, but a long bone is going to have the ends made up of hyaline cartilage. So if you just look at my finger right here, so here is a bone here, here's a bone here, and here's another one. And we have a joint between them. So if this particular joint here, which is covered in hyaline cartilage, is connected to this middle phalanx, which is connected with hyaline cartilage, and you go to bend your finger, it should, because it's going to have hyaline cartilage on top of hyaline cartilage, make it so that it's not making noise. If you have damage to it, it makes cracking noises all the time.
Can you pull your hand down? Oh, we're getting glare. There you go.
Okay. Mine crack all the time. So long bones, and that's finger bones, are considered long bones, as is your femur and tibia and humerus and ulna. They're all considered long bones. The other thing it does is your ribs don't attach to your sternum here. This pink stuff here is hyaline cartilage. So at the end of each rib is going to be hyaline cartilage, which will connect it to the sternum. And so that's really good, because as you take a breath in, you're going to expand your rib cage, and this is going to have some sort of, as it says here, resiliency to resist compressive stress. So let's just say your heart kind of stopped and you have to do CPR. And for anyone who's ever had to do CPR, you want to push as hard as you can on the sternum here to restart the heart. So the stuff that they show you on TV where the doctor comes over and he's just kind of pushing up and down, that is not going to restart your heart. For those of you who have ever done it or have worked on an emergency squad, you probably are going to think you're cracking the ribs, and you may hear a crackling. And that's okay, keep pumping, because this stuff, as you get older, starts to calcify. So the hyaline cartilage will calcify. The other places that you would find it is going to be the tip of your nose, because your nose bone doesn't start until here. So the whole tip of my nose is hyaline cartilage. My trachea here in my neck kind of moves back and forth. That's made of hyaline cartilage. My larynx also is made of hyaline cartilage. And so the costal cartilages of the ribs, not the ribs themselves, they are bone, but this stuff that you see pink here are made of this material. And so hyaline cartilage is the one that is going to serve as a resilient cushion, but resist compressive stress. So it works really well. Take note of this particular picture, and you'll notice, although you can't see it, there probably is fibers in the background, but on this is 470X, you're never going to see them. But the next type of cartilage, you're going to see them. And this one here is elastic cartilage. Same thing that we had with hyaline, it's just at a higher X. So this is 800 versus 470. Each one of these here are the chondrocyte in the lacuna. And the background here, instead of looking glassy like you have it here, has a whole bunch of fibers in it. The fibers are what's going to give it its ability to maintain its shape after it's been bent or twisted. So the two places you would find them is your external ear and your epiglottis. So here is my external ear. If I bend my external ear, it should boing back to its original shape. Or if I do it like this, it's going to go back to its original shape. The epiglottis gets a lot more work than my external ear. The epiglottis is in your throat, and it's going to cover, if this is the tracheal inlet when you swallow, and then it'll spring back, and then it'll cover it and spring back. And so the two places that you would find it is the epiglottis, which is that little springy type of thing covering your trachea when you're swallowing food, and also your external ear, not your lobe. The lobe itself is going to be made of, inside of there, just skin on the outside and fat. And so everything here, so for those of you who are girls or guys who have studs going through the tip of their ear, you kind of know it does not heal as quickly as if you had your lobe pierced. And the reason for that is as you're putting that stud through there, you are crushing these fibers going through there, and it's going to leak out some of the tissue fluid. That's why you get that yellow ooze after you've put studs in your ears, particularly in your upper ear. The last type is called fibrocartilage. This particular picture is kind of what it looks like. There is going to be thick collagen fibers that pick up a blue stain. So here is the chondrocyte in the lacuna, the little pink thing here. And so in this particular case, this one can absorb a great amount of shock. So you're going to find it in places where you would have a lot of shock. One of those places would be the intervertebral discs between your vertebrae, and also the discs, or it's called the meniscus of your knee. So as your femur is sitting on your tibia, you're going to have a pad of this that's going to absorb the shock. The discs of your back, I usually explain to my patients, are kind of like a jelly donut. So the outside of the jelly donut is going to be made of this fibrocartilage, and then the inside of the jelly actually of the jelly donut is going to be what can make this disc go flatter. It's because you've lost the inside portion of the jelly donut, or the inside portion of that intervertebral disc. So it has a good ability to absorb a lot of tensile strength, to absorb compressive shock. So if you jump off of a table, your ankle's going to pick up some of the shock absorbency, so will your knees. But if you land on your hiney, you can basically make that force go all the way up, and hopefully all of these discs are intact. One of the things we'll talk about when we finally get to bones is if you have a bone in this vertebrae here that's kind of weakened and you land on your rear, you can send the force up, collapse this vertebrae, and then send it back up to your neck. So having good fibrocartilage is an important thing, and it looks exactly like everything else, although this is at 125X, and it does have the collagen fibers that have stained. It is almost the same as this thing here at 400X, so 4 times the amount. But in this particular case, you don't see anything in the matrix, and you don't see any fibers stained at all, whereas you see a lot of stained fibers here in elastic cartilage. So easiest way to remember it is the elastic cartilage. The really two places are the external ear and the epiglottis, and the Fibrocartilage is going to be the discs of your knee, or if you want to say the intervertebral discs. And it's also going to line your pubic symphysis, which is going to be the connection of one half of your pelvis to the other half of your pelvis. So that takes care of the connective tissue and particularly the cartilage. And as I mentioned before, the avascular cartilage, because it does not have a vascular system at all, loses the ability to divide as we age. So anytime you injure yourself, those injuries are going to heal slowly. A lot of them are sports injuries, but later in life, as I mentioned, for someone who's getting CPR, the cartilage can calcify and actually ossify, causing those chondrocytes to die. And so if you push on it, you hear this crackling, crunching noise. If you're doing CPR, keep pumping anyway. So bone is going to be another type of connective tissue. It's specifically called osseous tissue, and it's going to support and protect the body. It stores fat and produces blood cells in the cavities, and we're going to completely deal with this when we get to another chapter, but it kind of looks like this. So in this particular, this is a cross section. I think it looks like someone cut a tree, and so here is the limb of the tree. So rather than having osteocytes, chondrocytes, these are osteocytes in a lacuna, and it looks like the concentric rings of a tree that's cut in cross section. Where would you find bone, osseous tissue? Well, of course, you're going to find it in bones. That's probably the easiest way. But in addition to that, you're going to add muscles attached to the bone, and it's going to provide a lever for muscles to move things. In addition to that, if you have a dog or you've ever seen some animal eat the ends of the bones, a lot of important things are in there. You're going to store calcium and other minerals and fat. The marrow inside of the bone is going to be the site of production for blood cell formation, both white and red blood cell formation. So the animals are pretty smart in the sense that they're grinding on the bones in order to get the nutrients out, except for chicken bones. They're going to splinter and cause your dog or whatever to have problems. So that's the third type, which is bone tissue, which is a type of connective tissue. So everyone likes to have bone as its own category, but it technically is in the same group as connective tissue. The last type of connective tissue is blood. Blood looks like this. So all of these guys that are red here are red blood cells. And then the ones that aren't red, that are a little bit different, are white blood cells. So because it came from a common embryonic origin, which is mesenchyme, it is considered to be a liquid connective tissue. So it's going to have a function of transporting respiratory gases, nutrients, wastes, hormones that they say is other substances, and it's going to be found inside of blood vessels. So that takes care of the blood portion. We don't do too much with it. I'm not going to ask you to identify this is an eosinophil, even though they got it labeled as a neutrophil. This is a large lymphocyte, but you're not going to have to identify anything of the blood outside of knowing that it is blood. The last couple that is its own category is muscle tissue. There's three types of muscle tissues. There is skeletal, which connects a bone to something. Cardiac muscle, that is so important, it's only found in the heart muscle itself. And smooth muscle is going to be in anything that is going to move something through a tube, and I'll explain that. So once again, I'll go back to these pictures because I think it explains it really well. I think this particular slide is a perfect example of a fillet of salmon. I talk a lot about food when I'm trying to do this. It looks to me like the segments of an earthworm here in this particular picture there. It is a long cylindrical multinucleated cell. So the multinucleuses things are not in there, they're over on the side. So think of them as watermelon seeds, and this would be fillet of salmon. They are going to have all of these stripes there, and you are under voluntary control of your skeletal muscle. So when we finally get to that, skeletal muscle is going to allow you to voluntarily smile, move, manipulate your environment, and it's under voluntary control. but it is also striated. So these stripes are called striations. And the location would be attaching to either your face, so you are not going to, in your muscles of your face, to your lips or other skin things that would allow you to smile or frown or whatever you want to do. But it's also going to attach, as you can see here, a ligament here is going down here to another bone. So it's going to attach a bone to a muscle to a bone. And it's called a skeletal muscle. It is under voluntary control. It is multinucleated. It does look like fillet of salmon, and it also looks like a segmented worm. Okay. Next one is cardiac muscle. Cardiac muscle is also striated, as you can see here, but it is only uninucleated, one nucleus per one of these. The important thing about this is it is only found in the myocardium, the heart muscles, the muscles of your heart, walls of your heart, and it is under involuntary control. Its purpose, here is the left ventricle, as it squeezes together, is to pump it through this and go up and around and then throughout the whole body. The way that I always remember this, if you want to think of this muscle cell here, it's going to have as a road, and here's the other portion of the road. In this road, we're going to have a speed bump. The speed bump is called the intercalated disc. Here's another one. Here's an intercalated disc, disc. All of these things that look like they're perpendicular to the lines going in one direction are the intercalated discs. What you'll find in A&P2 is an intercalated disc is going to do something which will make your heart muscle contract as a unit. The term that we use in A&P2 is a functional syncytium, meaning that as this thing gets the signal to these gap junctions, which are called intercalated discs, the heart is going to contract as a unit and relax as a unit. So you don't have to think about your heart pumping. So it is under involuntary control, and it does have specialized junctions, which are called the intercalated disc, and it is uninucleated, meaning each one of these has one nucleus. So that's the difference between the cardiac muscle and the skeletal muscle. Here is the skeletal muscle here, which is multinucleated. Remember, it looks like the watermelon seed, and it does look like fillet of salmon. And then here is going to be the cardiac muscle, one nucleus, but you have this road, and then each one of these, if you want to think of these as a little speed bump, that is an intercalated disc that ensures that that muscle contracts as a unit and doesn't like hiccup, like, I'll contract when I want to. The third one doesn't have any striations and is also involuntary, and it's more spindle shaped. So this is really what it looks like. This is what you would see under a microscope at 500x. And the purpose of this is to propel things through tubes in your body. You have lots of tubes in your body. Here is the esophagus going into the stomach, which is a tube, which is going into the small intestine, into the large intestine, and all the way out. So in order to, an example that I always remembered, when you get to the end of your toothpaste, you got to milk it or squeeze it all towards the cap. That's basically what's going to happen. As you ate food here and it goes down your esophagus, it is going to squeeze it down into the stomach. Then it's going to stay in the stomach for a while as you mix the acids in there until it's time to release it, going all the way through the small intestines, into the large intestines, and then finally you'll poop. So that's basically it. It's a whole series of spindle-shaped or elongated cells that are going to be close together that will help you to move things from one place to the next. And that is the end of the muscle tissue. The last of the four tissues is going to be nervous tissue. Nervous tissue is consisting of a neuron and also anything else that's going to. We're going to cover this when we finally get towards the end of this semester. But if you want to think of this as the neuron and each of these processes, which is either going to be an axon or a dendrite, these are what's making up your brain, as you can see here, and also your spinal cord. So the purpose of this, or the function is this, to send signals from one place to another. it is going to consist, in this particular example, this is going to be the neuron. And or each one of these things, I think it looks like a cobra on the end of it. So each one of these in your brain may have up to about 10,000 attachments. That's insane to think about that. So the brain, the spinal cord, and the nerves are all going to have an electrical signal to it that it's going to talk to 99,999 of its friends to send a signal from one part of your brain to another part of your brain. And it does it super fast, like in thousandths of a second. So this is one of the things that they're finding out with people who have Alzheimer's, is that these neurons are not communicating with other neurons. And the best way that I can explain that is by something that I read, is that if your brain is kind of like Swiss cheese. So Swiss cheese is that cheese that has a lot of holes in it. And if the cheese is not contiguous with the next portion of cheese, you got a space. That's what they think Alzheimer's or dementia is. It basically is these connections aren't connected anymore. And so that's why there is a lot of problems, particularly with the elderly, in the sense that they can remember everything from 50 years ago, but they can't remember what they're doing next. So this particular type of tissue, and this is about the only slide you'll see of it, is nervous tissue. Where are you going to find it? You're going to find it in your brain, your spinal cord, which is both of them are your central nervous system, and then any nerves that are going to and away from the central nervous system, which is called your peripheral nervous system. That is basically the end of the histology portion. The only thing else that I'm going to put in a separate one is going to be the skin, and I'll talk about that. And it's mostly going to have on the outside of it stratified squamous epithelium. So, look over this one. I think it took me another 45 minutes of this, and so look at it many, many times. Look at it with your lab book so that you can see that the pictures that I use are different than the ones that are in the lab book. But as long as you got what it looks like, because I'm going to ask you what is this, where you would find it in the body, and lastly, what is its function?